Hi guys, it is me again. So welcome to my YouTube channel. Please subscribe if you have not subscribed. Like, share, comment, and remember to turn your notification bell so that every time I post a video, you will be the first person to be notified about my video. So today I want us to learn about something that is also very important, mostly in ladies or women. We know that ladies are their life or their body is always precious. So the topic we want to learn today is also very important for your mother, for your sister, for yourself, so also for your wife if you are a man. So today we want to learn about something. The topic is abnormal menstruation. As we know that most ladies usually menstruate at most 7 days and at least 3 days, and the cycle usually take at least 26 days to 32 days, and the regular cycle is always 28 days. So when your cycle is not in between the 26 and 32 days, you usually have irregular period. And sometimes there are so many causes we are going to see in this video. I'm going to talk about the examples of menstrual problem and abnormal menstruation and the causes and how to manage them. So let's see. So in this video, let's learn about examples of abnormal menstruation. We have amenorrhea. This is just totally lack of period. You don't menstruate at all. We are going to see the causes. Another one is dysmenorrhea, period that usually comes with pain. There are so many causes that can cause that pain. So if you have not watched the previous video, please go and do so that you know the causes of the causes of period pain. Another thing is oligoamenorrhea. This is a type of period that is infrequent. It comes so little. You can only menstruate once. One day. Imagine one day you are menstruating one day, and it is just like that. Or abnormal uterus bleeding. So there are so many causes. You can be having abnormal, maybe growth inside your womb, and you don't know, so you will be bleeding in between the periods. Yes, those are the abnormal examples of abnormal. Among others, I'm saying among others, there are so many. I cannot list them all. Those are the common ones that usually happen when you have abnormal menstruation. So we are going to an examples of menstrual problem. Examples of menstrual problem, where you get that your period comes in less than 21 days. The usual period your cycle is less than 21 days. Usually your cycle should be within 28 days or at most 32 days. If it is less than 21 days, you are having abnormal menstruation, or you are having a problem with your menstruation. Another thing is that when you are missing period in between the cycle, in between the cycle, you can menstruate for 2 months, and then again you miss 2 months, then again you menstruate 3 months, you miss again 1 month. That means that you are having problem with your menstruation. Another thing is the menstrual flow that is always lighter than usual. How do I say? It is lighter. And another problem is also another menstrual flow that is heavier. You are having a heavy menstrual flow. And another thing is also bleeding in between the spotting in between the cycle. Those are the problem of menstruation. And what are the causes of this pain during menstruation? Spotting in between the cycle, having periods that is infrequent, having oligoamenorrhea, metrorrhagia, all those. What are the causes? sometimes it is our lifestyle and stress. Any stress or any lifestyle that can change your normal functioning of the body, that can raise or increase your hormones, will always change your menstruation, or will always cause a problem in when in your cycle. Another cause is polyps inside the womb or fibroids. When you are having fibroids, you will always experience a lot of pain during your menstruation, or you will always have abnormal menstruation that is a lot, menstruation that is sometimes is accompanied by a lot of pain, nausea and vomiting, a lot of problem when you are menstruation. Another thing that can make you have abnormal period is when you have cervical cancer or uterine cancer also, that has not been diagnosed. You don't know that you have such a disease or such a condition, and you are experiencing this problem of pain during your menstruation, heavy flow. Sometimes it is always good to go and see the doctor, so that you get checked up to know how you are living, or how the condition, your condition. Another thing that can cause abnormal menstruation is when you are using some drugs that can change the function of your hormone, the function of your system. With some of the drugs, when you're using them, they usually decrease your hormones or elevate them. So sometimes if you are on those drugs, you will end up having abnormal menstruation. Another thing that also can make you to have abnormal menstruation is when you are having these conditions such as diabetes, the chronic condition that also can cause your menstrual flow to be abnormal. And also when you have a complication from abortion. If you have not watched about the video about that I was talking, the previous video that I was talking about abortion, please go and do so that you know the complication that might arise when you have abortion, or when you have a habit of doing abortion, more so these abortion that are unsafe. So the complication that can arise when you have complication related to abortion, you can also have some of the menstrual problem, heavy bleeding, heavy cramps, nausea and vomiting in your period, spotting in between the period that sometimes does not exist at all, or sometimes so many things that I've said are abnormal when you have them. Another thing that you can also have when you have an ovarian cyst. Ovarian cyst, usually it is the ovary is filled with fluids, so that when you're ovulating, there's some fluid that fill your ovary. So when these fluids are inside your ovary, or they have filled the ovary, sometimes when you're menstruating, or if the cysts have been formed, you can always experience this pain. So my advice to you is that when you experience this abnormal menstrual flow, please go and check with your doctor, so that you know the cause. Some of the causes you can manage them. So if you are having the abnormal periods that are manageable, you will always be in a position to manage them. You will change your lifestyle, you avoid stress, you rest well, you can take some contraceptive pills as prescribed by the doctor, just to balance your hormone, not for any other purpose, just to balance your hormone, so that your menstruation can be regular. And also you avoid intense exercise, you control your weight, or you control your weight to be normal, not overweight or underweight. Sometimes when you are overweight, you end up with this complication, or when you are underweight, you can also experience this complication. So therefore, and if you can't manage them in this way, you sometimes you have a problem. So it is always good to go and see your doctor. I will always insist like that. Go to the health facility, any health facility, go and see your doctor, so that you can be advised on what you are supposed to do, the right thing that you are supposed to do, without bringing so many complications into your life. Bye. Thank you for watching. Let's meet in my next video.